Mrs. Johnson? Hi, how are you? Good? I'll be performing your mammography. There's just a couple things I need to ask you. What's your full name?
Sergeant Johnson,
Okay, and your date of birth?
25th December 1971.
Okay, perfect. Please follow me. We're going to head over to the room.
The main goal of this preparation is to make sure that there are no artifacts showing in the image. We will instruct the patient to remove any deodorant or powder from the axillaries and breast as it can mimic calcification on the image. Instruct the patient to remove all clothing from the waist up and to wear the gown with the opening in front as the breast will be exposed for imaging. Ask the patient to tie their hair back and take off any jewelry, glasses, or nipple piercing if she or he wears one. The technologist will review the questionnaire with the patient, such as the reason for the visit, any previous mammograms, menstrual history, as well as a medical and a family history of breast cancer. The mammographer will also ask the patient if she is pregnant and or nursing, as this will increase the sensitivity of the glandular tissues. A physical assessment will be done prior to the exam. The patient is instructed to lift her arms up and to expose the breast. The tech will perform a visual inspection and palpation of each one carefully. The tech will note down any skin abnormalities, palpable masses, location of scars, and nipple alteration.
I'm just going to clean this right before we do our exam.
Thank you very much.
Okay.
Explain the procedure to the patient, including the possibilities for additional projections. At least 2 images will be taken on each breast.
I'm just going to ask you to come as close as possible as you can to the mammography machine. And I'm just going to support your left breast, lift it up, and put it on the IR. Okay, maybe come a little closer to me. Yep. I know it's slightly uncomfortable, but okay. So I'm just going to raise the IR a little bit. Okay, try to stay as close as you can. This might be slightly painful, but it won't be long. Try to stay as still as possible. Okay, good. So I'll be right back. I'm just going to take the image. Okay, try to stay as still as possible. Stop breathing. Okay. It's over. Okay, Sarah, I'm going to ask you to come as close as you can to the IR. I'm just going to grab your breast and put it on. Okay, can you raise your left arm and put it on the machine? Okay, come a little closer to me. Yes, perfect. I'm just going to compress your breast. It might hurt a little bit, but it won't be long. I'm just going to take a seat. Try to stay as still as possible. Okay, perfect. I'll be right back. I'm going to take the image. Okay, I'm going to ask you to hold your breath. Stop breathing. Okay, you can relax. You can breathe.